there. Today, we're going to explore the topic, why healthcare needs transformational leaders and not managers. So I'm going to be a little blunt. Healthcare doesn't need more managers. It needs transformational leaders. Because right now, leaders are managing harder than ever, tracking metrics, filling out reports, putting out fires. In the meantime, staff are burning out, patients are losing trust, and the system is crumbling under the weight of all of this. So the truth, managing will never fix this. Only transformational leadership will, and that's what I'm going to talk about today. So when I was a nurse practitioner, I thought leadership meant just keeping things organized and efficient. But what I saw in every single setting, it was emergency rooms, clinics, personal care homes, visits, all the different places that I've worked, is leaders were drowning in administration, staff feeling unheard and unseen and unappreciated, and patients slipping through the cracks, complaining, or maybe even giving up. And it was the same stories on repeat. And so I'll never forget this one patient. She had been bounced from doctor to doctor for years, her symptoms dismissed, her chart overloaded with notes that nobody would possibly take the time to read. And when I sat with her in her own living room, she told me, nobody ever listens to me. And that completely broke me because I realized it's not more management that she needed. It is actually leadership that would be willing to pause, listen, care, and willing to work to change the story. So this was a huge turning point for me. And I couldn't keep pretending that managing harder would somehow heal the broken system. It's not possible. So you might ask, or you might be asking, what is the difference between managing or leadership and transformational leadership? Well, management is about control, and leadership is about change. And so Peter Drucker said it best. Management is doing things right, but leadership is doing the right things. So in healthcare, I'm sure you've all seen it. We've perfected doing things right, tracking indicators, checking the boxes, following policies, squeezing out as much productivity as possible. But maybe we've lost sight of the bigger question. Are we doing the right things? And so 70% of team engagement is determined by the quality of leadership. So it's not the budget, it's not the policies, it's leadership. And the World Health Organization has now officially classified burnout as an occupational phenomenon, especially in healthcare, as you can imagine. And so burnout is not an individual weakness. It is, and I'm going to be bold, it is a leadership failure. And so in Canada, the patient satisfaction directly correlates with staff satisfaction. So if your staff feel unseen, your patients will as well. So when it comes to transformational leadership, and let's face it, regular leaders get stuck doing a lot of managerial stuff, management. But when you flip it to transformational leadership, then it's about inspiring instead of just instructing, right? It's about listening instead of silencing. So they create trust in many different ways, even setting an example instead of just enforcing compliance, right? And I remember studying recently in my MBA, John Cotter. He's the master of change. He developed the 8-step change model. He said, management is about coping with complexity, and leadership is about coping with change. And let's face it, healthcare right now is nothing but change, which means we don't need more managers. We need leaders who can not only transform themselves, who can lead themselves effectively, but also lead their teams and their systems all at the same time. So why is this important? Like, why does this even matter? So let's just get really practical here. So here's what happens when healthcare stays with management as usual, which, we're seeing more and more that it doesn't work. So staff disengage. And let's face it, disengaged employees cost organizations like billions in lost productivity, and healthcare is feeling it in terms of turnover and shortages. And patients completely lose trust. So here's what they do when they lose trust. You get high no-show rates. You have people self-diagnosing on Google or using AI or ChatGPT. They file complaints, and the system spends all this time on resolving conflict instead of doing the care that's most important. The third is that leaders burn out because they're carrying impossible loads. They're stuck between government policies and frontline demands. And it's like, how do they even get a chance to feel effective at what they're doing? And so here's the thing. You already know this pain because you're living it. But I want you to take a moment to just take a deep breath. And I want you to imagine this instead. A workplace where staff are energized and loyal because they feel valued. Patients who trust the care they receive because they know they're being listened to. And you know what? When you do that, you're not going to see the no-shows, the self-diagnosis, the complaints, and the conflict. They will trust the care they receive, and they can rest and relax and go home and heal. Imagine leaders who bring peace and clarity to their teams instead of bringing chaos and overwhelm and stress. So that is what transformational leadership creates. It creates a different workplace with valued people. It brings trusting patients, and it has leaders who bring peace and clarity to their teams. And that's what matters now more than ever. So here's the bottom line. Healthcare does not need more managers. It needs transformational leaders. Managers can keep the machine running, but only transformational leaders can heal the culture, restore the trust, and create systems that actually serve people. This is so important. Managers will keep the machine running, but only transformational leaders can heal the culture, restore trust, and create systems that actually serve people. And so if this message really touches your heart and resonates with you, here's what I want you to do next. I want you to subscribe to this channel. I share at least weekly videos on transformational leadership and grassroots healthcare change. Number two, I'd like you to share this video with a colleague who you think needs to hear this. And if you're ready to go deeper, if you're ready to learn how to become a transformational leader in healthcare, that's exactly what I teach in my Transformational Healthcare Leadership Program. And I will put a link in the comments below for you to join the waitlist for this program, because systems do not transform on their own. Leaders do. Thank you for being here, and I'll see you on the next video.